Hello and welcome to Veterinary Journal Club. This is going to be our, I guess technically second, but first real episode of Vet Books.
Chapter 1.
And Hippo
pilot
wants to be part
time.
of it. Yeah, it was the pilot. Yeah, it's like, we'll see if the studio will accept it. They threw it away and they're like, no, you're going to need to redo that.
Yeah, do a couple episodes.
I think so far people seem pretty excited. It's only been like 2 days since you put it up. I got an email.
Not to the
to me,
podcast
somebody
email,
who,
just to you.
yeah, nobody ever emails out on it. Or do you check it still?
Yeah, check it. We get one every now and then.
But Dr. Miller, thank you for reaching out. And she was excited because I think where she's at, they're going to be reviewing the same textbook. And she was like, oh, that'll be nice to have another resource, something, just a different perspective.
Yeah.
So that'll be good. And then a couple other people we met for dinner recently were like, yeah, we listened to it and we're really excited about the games that, you promised us. So thank you for that. Thanks
we
to
have
Foster's.
a simple game at the end because I didn't have time to do a
I don't,
one.
well, Topher does. I don't know what this is going to be. So shout out to Topher for coming up with the idea because people so far seem to like it. And apparently also coming up with some game. I don't know what it's going to be. So I suspect it'll make me look stupid.
Yeah, that's the goal.
Yeah. All right. So this is your thing. What are we doing?
Oh, we're doing Chapter 1, Triage.
I know, but like, what are we doing?
We're just talking about it. You're going to tell us about triage. And
Why don't you tell us about triage? You read up, right? Didn't you do homework?
No, I'm not a veterinarian.
I know, but that's the whole point. You're supposed to learn.
No.
Okay.
You have to pay a lot of money to read that book.
You don't have to pay money to read it. You have to pay a good bit to buy it and probably to understand it. Okay. So the first chapter, as we said last time, is, we'll just remind the book, is Small Animal Critical Care Medicine, 2nd edition, edited by Drs. Silverstein and Hopper.
Who wrote Chapter 1?
Chapter 1 is Dr. Erica Reinecke. I was getting there.
Yeah.
And it is, appropriately enough, on evaluation and triage of the critically ill patient.
Is that appropriate because that's the first thing you do?
Place to start. Yeah, let's start at the very beginning. It's kind of everything else follows after this. So
except for the phone call.
Oh, for crying out loud!
Right?
You want to do a whole thing on phone triage?
Is there a chapter on phone calls?
No, there's not a chapter. But
there's not a chapter on phone calls.
We could do a chapter on phone triage.
That seems to be like the main thing you guys do.
Here's the takeaway for phone triage. Tell them to come in. That's my advice. If you are unsure, tell them to come in. And usually what I tell clients is, you were worried enough to call. So probably you should come in. So unless there's something very specific, they're like, is it toxic for, my cat to eat a single blade of grass? And you can be like, no, your cat's fine. So, unless you're like really confident that what they're talking about is totally fine. Most of the time I'm like, I'd rather take a look at the animal and, our exam fee is this many dollars. And, if that's worth your peace of mind, come on in. If you don't have that money, then it's, I'd still recommend you come in. I get that's a tough thing, but anyway, so that's phone triage in a nutshell. Come on in so we can look at you in person.
Are you worried? Come in.
Yep. Again, and that's what I say. You were worried enough to pick up the phone. Which especially today, people are like nobody wants to call anybody. They're like, do you have a way to text? Can we email you that we're coming? So if you were worried enough to actually pick up the phone and call, you're pretty worried, you should come in. All right. So getting to triage and the way this chapter is organized, it was funny when I was kind of looking through it. I teach and talk about triage quite a lot. And so there's a number of things that I do a little bit differently. I do start the same way, which is just a definition of what triage is.
Yeah.
Did you pick up on that?
What
triage means?
Yeah.
Triage is a French word. That was a terrible French accent, but do you know what the word means?
Yeah.
What does it mean?
It means to separate.
Ooh, so close. I don't know if I'm going to give you full credit for that.
Oh yeah?
Yeah, it means to sort.
Oh yeah. Do you want to look it up?
Yeah, let's Google it. Did you Google it?
Huh? Maybe.
Did you? Yeah. I've always thought it was. I've been telling people for years that it means to sort. It's a French word.
It's the same thing for English.
Yeah, kind of. That's why I was gonna. I'm not sure. I want to give you. All right, Google triage.
She Googled triage.
Definition. Well, I'm struggling to spell definition.
Because triage is a conjugated.
Trier.
Yeah.
Triage with a ZH sound in medical use. The assignment of degrees of urgency to wounds or illnesses to decide the order of treatment of a large number of patients or casualties. In quotes, a triage nurse. Translation. Yeah, I want to know. Blah, 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 blah. No. French, trier. It says to separate out. Ooh, all right. You can have credit for your answer then.
Yeah.
And then the next one is the action of sorting items according to
it's
quality.
the same thing.
Yeah.
They probably don't have a word for sort and a word for separate.
Yeah, I don't know. I wanted you to get it exactly right.
Yeah.
Yeah. Okay. So to sort or separate, I don't know. Sometimes you can sort things and put them together. Like that's a way of sorting.
Yeah.
So I'm like, it doesn't have to be a separation. I guess that's why I think of it differently. Anyway,
I think it's more
let's not
dumping.
spend too much time. No, because you can be like, okay, I'm going to put all of the oranges together and put all the apples together, and that's a sorting. But you're not.
Well, you're separating the apples from the oranges,
right? But you're also putting all of the apples together, which is not separating.
Well, if you just had
them.
apples, you'd just be dumping apples. They would just
right. But if you had a bunch of apples and oranges all mixed together,
you separate them.
You separate the apples and oranges, but you clump together the apples. So they're not being separated, they're being sorted. Okay, we are spending way too much time on this. As long as everybody
Gryffindor.
Yeah, exactly. All right. So triage.
Cat's bite.
To sort, to separate. Oh, well, he should stop that. You need to stop letting him do that. Okay. So we're sorting things out. That's how I like to start. It's sorting. It's a sorting hat, if you want to keep with the Harry Potter references. And I think about this in a couple different ways. There's either, like a disaster scenario where, there's lots and lots of different things and you have to sort everybody out into, what they need. But most of the time in veterinary medicine, we're talking about like assigning an individual patient a degree of urgency. And I think the schemes that make the most sense to me are the ones that assign a time limit. Like, this category needs to be treated immediately. This one needs to be treated within 15 minutes. This one needs to be treated within 30 minutes, 60 minutes, a day, a week, a year, whatever.
Yeah, it seems like for most of your stuff,
Something
it's more
concrete.
along this one needs to be in the next few hours. This one needs to be in the next day.
Sometimes, well, it depends, because sometimes we see things that aren't really truly emergencies. But sometimes we think things like, no, right now.
Yeah, what's a good example of like an
now.
instant, an hour, a couple hours, a day?
So, we're jumping ahead a little bit. But yeah, I mean, it's basically, do you think this patient is going to die in the next few minutes without intervention? And if the answer is yes, that's a right now.
Yeah.
Do you think this patient is going to die in the next few hours without intervention? That's a maybe, if you have both of those, you're going to do the right now patient and then immediately afterwards the next one. But the whole reason, the other thing I like to talk about, and I don't think they went into a bunch of depth on this in the chapter, it's kind of mentioned a little bit, is this is just a recognition that we have limited resources. If you had unlimited resources, this wouldn't be so much of an issue, right? Like if you had, although there would still be one resource that is limited and we can't get enough of. Do you know what it is?
Time.
You're so smart.
I hear you can save it in a bottle.
Yeah, no, if you could save time in a bottle is how the song goes. If he could save time in a bottle, these are the things he would do. Yeah. But he can't.
He'd only do one thing.
Jim Croce? Is that a Jim Croce song?
I forget.
I think it's Jim Croce. We'll look that up later. So, but most of, time is definitely a limited resource, but the other resources that are limited are going to be just like personnel. How many doctors, technicians, assistants do you have? Space sometimes is limited. Supplies. But time is the one we're fighting, I think, more than anything. And so even if you only have a single patient and you have otherwise unlimited resources, you're still racing the clock. And so triaging is still important to sort of sort out that single patient. A lot of times, especially in human medicine, it gets discussed in, again, disaster situations. There's a large number of patients and we have to sort the patients into categories of who's being treated right away and who's not. The other thing, and apologies if I missed it in this chapter, which is definitely possible, because they probably did. I don't know. Let me look over it again. There are a number of triage systems or schema that have a category dedicated or kind of set aside for patients that probably, if all other things being equal, would be treated immediately right now because it's very likely that patient is going to die. But like, imagine if you're in a disaster scenario and you have truly very limited resources. That's a patient that like, if we threw all of our resources at this patient and everybody stopped what they were doing to try to save this one patient, chances are it would die anyway. And how many other patients would die while we were trying to save this one that's probably going to die anyway? So we're not going to treat that patient.
That seems like a later chapter thing.
Oh, is this a little?
It's a little heavy for the first chapter.
Should I not have brought that up for the first podcast in the series?
Yeah, I don't think in the Game of Thrones they kill. Well, I'm sorry if you haven't seen it. It's been out for 20 years.
You don't have to name names of who gets killed.
Yeah.
The characters get killed in that show.
Yeah, they kill like the main character at the end of the first book, not the end of the first chapter.
Well, this is real life, and sometimes like bad results happen right away.
Yeah.
But the reality is that sometimes you don't have enough resources and you have to make tough decisions. And it's not like those patients don't get anything. They get like hospice care, pain management, that kind of thing. But like we literally would have to sacrifice dozens of other patients to try to save you, and you're probably not going to make it anyway. So we're not gonna. And that's a tough decision to make. But at any rate, I think it's still important to discuss and for people to know that.
Well, it's good to know, like, when you're in that situation to be like, oh, yeah, we can't. Like, you treat them as they come in.
Yeah.
Even, like, they're all the same degree of, like, everybody's an emergency.
Yeah.
Like, say
Right.
they did a dog run and it was real hot and they didn't think to have water.
You've told me that story. Or
I
I've
think
told you
that's your
that story.
story,
No,
yeah.
no, you've told me. I've told you that story.
And everything's critical and dying, and you have to... make who has the best chance.
Yeah, sometimes when you don't have enough resources, you do have to make hard decisions.
Yeah, that's
about
probably
that.
where triage like originally started. With it's like, who do we decide to leave on the battlefield?
Sometimes, yeah. I mean,
who do we
that's
take
definitely in
back?
military. I think military is probably when the triaging started. I think they mentioned that in the history of this, actually. Battlefields in the mid 1800s. It's like the second sentence in this chapter. Good job, Erica, researching that.
Yeah, the French have all like the battlefield things, like Mayday.
A ton of, is that a French thing? Mayday?
Yeah, Maydar, it means to help. So when you say Mayday, you're screaming help in French.
Mayday, Mayday.
Help
Do you have
me,
to do
help
it
me.
with an accent? Does it help? Do you
I
get
don't
more help
know.
that way? So, I mean, war is actually like sort of morbidly where a lot of medical research like advances by leaps and bounds, because there's just out of necessity, you're like, people are dying all over the place. Let's try things. And then, in the military, you're not as bound by regular rules, I guess.
Yeah, because everything.
It's like we just need to do something right now. And
there's so
military
much
is
going
sort of,
on.
Yeah, they have their own set of
They're
rules.
overwhelmed.
That
when
obviously
something's happening.
We have historical examples where that went horribly wrong.
Yeah.
But even like with good intentions, like we have to try things, but you also have a lot of patients coming through in a short period of time that you can collect a lot of data on.
Mm-hmm.
But anyway, we're getting a little off track. So triaging, treat right now, like get started right this second. And then the thing that I focus on a lot when I'm teaching triage is actually just the triage exam. Like I spend a lot of time talking about how to do it. And because I think that's really important to like be good at that and be efficient at it. And I usually tell students, like, you have 1 minute to do a triage exam. So we take an hour and a half to talk about how to spend that 1 minute. We're not going to take an hour and a half today, don't worry. But you really want to be able to quickly and efficiently assess a patient to categorize it. And, what are the life-threatening things? And so this is one of the areas where I kind of disagree in the chapter. Not a whole lot, but just a little bit I disagree. So when they talk about the primary survey, or basically your initial triage exam, what are the systems that you're going to evaluate? And so the systems that they include are the respiratory system, the cardiovascular system, the neurologic system, and the urogenital system. And that fourth one, I don't count. And I don't count it in my triage exam for the, do you know why? Do you have a guess? Why? Why don't I include that? Yeah.
Because it takes a while. You have to do a test. You can't just feel it.
Not even that. So what happens if you take both of somebody's kidneys out?
They die
When?
in about 5 minutes.
Nope.
No?
I mean, I suppose if you didn't like suture up the bleeders and stuff like that, but if you like surgically remove somebody's kidneys, both of them, it's going to be a few days before they die.
Yeah.
Yeah. Yeah. Like assuming they were otherwise healthy before you harvested healthy kidneys. Cause for the black market, there's, I don't know, you took their kidneys. Yeah, you're a sadistic person.
That what?
Because the kidneys are filtering the blood, and then I
feel like they said that you have like a certain number of hours because of the thing where you wake up in the bathtub
of ice, blah blah. Yeah, that's it's probably a few days before you die.
Oh, do you know how much? I think I saw a thing. Like if you sold the entire human body on the black market, it's only like $50,000.
Oh wow!
So that's that kind of stuff doesn't happen because it wouldn't be worth it.
Yeah,
I'm going to steal
so many
somebody's
reasons
kidney
that doesn't happen.
And make
you wake up in a hotel room in a bathtub full of ice, and you have a sore, incision over your. Yeah, you're like, yeah,
we could steal his kidney or his watch.
Yeah. Anyway, plus you don't know what kind of kidneys you're getting. Anyway, but it would take a few days probably for everything. Like patients that go into severe, like they don't die instantly. They usually, at least a day or more before you die.
What if you woke up in the bathtub of ice and the note was like, it's like, you need to go to a hospital. Your kidneys are terrible.
We tried to steal them, but we left them in you, but you should probably, here's our number. Call us if you want a new kidney. But anyway, so that's the reason, like if the urinary system shuts down, it's obviously very bad. But the reason that patient dies is because of the effects of not having functioning kidneys and what that does to probably your heart. You're probably going to die because your heart is not going to work because you have a buildup of potassium, and then that causes arrhythmias, and you're probably going to die from that. So, and the reason I'm like, I don't care about the urinary system is I could have the block cat is the thing everybody thinks about. Like, oh, we got to triage them right away. But I could have 3 block cats, and I have to be able to sort the 3 of them out, and I'm going to use those other systems. So being able to identify which one is stable or not, or which one needs to be treated urgently or not, falls under the first 3 systems and not under the urinary system. Now, I'm not saying that you do your triage exam and then ignore that patient forever, right? I would like to think that we get to those patients like much, much sooner in most circumstances. But the initial triage exam, like when I'm thinking about in practice, I'm trying to decide, does this patient need treatment right now? Right this very second, or can we hang tight, get the full history from the client, get a little more information before we have to go, hey, we need to start making treatments. You need to allow us to do that. And it's going to cost this much money and we don't have time to have the conversations. Like I'd much rather take our time, not a ton of time, but take a little bit of time to process everything and to do a thorough job versus a patient that I'm like, okay, this one is stable. That one can wait 15 to 20 minutes until we can go back and do our full assessment. And it's true that, part of the initial triage assessment ideally includes like a very brief medical history. What are they coming in for? Do we know any, important comorbidities and things? And some of those will, by their very nature, kind of prompt us to move more quickly, even if the patient is currently stable. So if we hear that, the 3-year-old male cat has been going in and out of the litter box, and God, he's being really adorable right now. For those of you that are listening, Hippo is just like cuddling with Topher right now on the couch, and
because he's a good cat.
He is a good cat with you sometimes. Yeah. Anyhow, that initial history can also kind of, speed up or slow down my process. Hopefully not really slow it down, but speed up my process or not. To say I know I need to move quickly, because even though this patient is currently stable, there's potential from the history that could change. Well, but I'm still going to see that patient.
It'd slow you down if you had other patients that you needed to see more. But
that's the thing is like if I don't have any other patients, it doesn't matter how stable this patient is. I'm going to get going right now. Now I might not skip the step of getting a full history, and I might not skip doing a full exam, but I'm not going to be like, come back in 2 hours because that's what the triage system said it should take before I treat you. Like it's really only when you have to choose between patient A, B, C, and D. And when I'm having to choose, I don't actually care specifically what the urinary system is doing right this minute. I don't. Because again, I could have 2 block cats that show up and I need to be able to distinguish between them. So that's my personal kind of foible on that. Yeah. So And then there's a few other things that I think there's more nuance. It's hard when you write like book chapters like this.
It's only like 3 pages.
Yeah, and it needs to be.
It's very fine print, 3 pages, but
it's not very fine print.
It's
just
very
a
fine
large
print.
book.
Yeah, that's a lot of words.
They're like 8.5 by 11 pages. It's a lot of words. There's a whole big table figure right here that doesn't take up that much, or takes up a lot of space and isn't that many words.
There's a table full of words.
And then there's another table right here. This page has barely any words on it. It's a table full of words. What are you, against words?
I'm a visual learner.
Blah, blah. You're such a smart aleck.
No, I'm not.
I mean, you are in the sense that everybody is, unless I suppose you're blind, and then you're probably not a visual learner, but you can still learn a lot. Anyway, so this chapter goes through a little bit on the specific things you want to evaluate for each system. I think it's important to emphasize that the triage exam is not a full physical exam, which you know because I said you can do it in 60 seconds, and you can't do a good, thorough physical exam in 60 seconds. So you're doing a brief assessment of the respiratory system. Are they breathing? And if they are breathing, is it really labored? Are they, do I anticipate they're going to have a problem really soon? The cardiovascular system, what's the perfusion? So, I need the heart rate. I need pulse quality, mucous membrane color, capillary refill time. I think, because they'll talk about a few other things in here that, again, I disagree with a little bit.
She's negative Nancy on
I'm
this
not
chapter.
a negative Nancy. I just like to point out the things where I'm like, yeah, I don't know. This is just a different perspective. So there's blood pressure readings that are on here. And in theory, that sounds lovely to get a blood pressure. The problem I have with getting a blood pressure is that non-invasive blood pressure measurements in dogs and cats are terrible. And they're terribly inaccurate. Like, I just don't trust them. And during a triage assessment, I don't need them. And I use this example for students a lot that
You can't just wear the arm cuff and relax.
yeah, we put the arm cuff on them. The problem is they're all
their legs.
I know. Uncross your arms, uncross your legs, rest, look up, calm down. Try not to think about what we're doing, blah, 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 blah. But also they're all different shapes and sizes. And there have been multiple studies that demonstrate that our non-invasive blood pressure measuring devices are really inaccurate. And they get less accurate the further from normal you are.
Yeah, it would be like if
Womp womp.
aliens abducted you and took your blood pressure, and they'd be like, this is a little high.
Okay.
Right?
That's an interesting analogy.
Right, because you can't speak to them. You don't know what they're not using the cuff. They're using some alien blood pressure thing that's probably weird.
I mean, that might be what the animals feel like when we do it.
Right, because they don't know you. You've just been
funny.
abducted by an alien.
You mean that causes like extra stress and stuff
Yeah.
like that? Well, even with that though, like it's just they're not accurate. Like they don't reflect actual blood pressure when you compare them to
And
invasive
how would
blood
aliens
pressure.
know like the right way to do blood pressure on people?
You're being such a goof about the alien thing. You're getting kind of stuck on that. At any rate, I don't include blood pressure reading as part of a triage exam. Plus, it takes too long.
It doesn't fit in 60
help.
seconds.
It definitely doesn't fit in 60 seconds. And here's the problem I have with it.
I was just thinking of you doing like a triage like Nicolas Cage in the movie where he steals the cars. Gone in 60 seconds.
Okay.
You haven't seen that?
Once a long time ago. You're going to have to explain.
Yeah, he steals a car in like 60 seconds. They steal
Oh.
a lot of cars.
Just
imagine
gone in 60 seconds.
Triaging like
Triage in 60 seconds.
all these.
You have the title that you're going to have to find that, and you'll splice my face onto it for the.
Yeah. Oh, no, I'm using the book chapter
Brr, brr.
stuff for the
Okay, fine.
picture. Ah.
Bye.
Oh, I think it might be almost food time.
It probably is. What time is it?
Oh, no, they got an hour.
No, they have less than an hour. It's almost food time as far as I'm concerned. Okay. So if you have a patient that comes in and you're triaging it, and it's a dog and it comes in laterally recumbent, it's super tachycardic, its pulses are weak, its mucous membranes are pale pink, white, prolonged capillary refill time. It looks terrible. Its temperature's, low. And then you get a blood pressure and the blood pressure's normal. You're going to be like, I guess this patient's fine. Everything's fine. I don't have to worry about it. No, you're going to ignore that. And similarly, if a patient comes in, walks in, it seems, pretty bright. It's responsive to you. Its vitals are normal. Its heart rate is normal. Temperature is normal. Pulses feel good. Gum color is good. Capillary refill time is normal. And you get a blood pressure that says the systolic blood pressure is 65. You're going to be like, no, it's not. And you're going to ignore it. And if you can ignore it when it doesn't fit what you're expecting, then why would you trust it other times. Like you don't need it for a triage assessment, in my opinion. So, but I think I just get frustrated because people like, oh, they have a patient and they describe it as being in shock. And you're like, cool, you described everything that it's in shock. And then you give me a blood pressure and the blood pressure was low. And you're like, yeah, I know, you told me it was in shock. And then everything after that, they're just like, so then we did these things and then the blood pressure did this and the blood pressure did that. And I'm like, but what did all the things that I actually trust do? Like what did the heart rate do? That's a measurement that you can get pretty accurately. Like if you can count and or do math, you can get a heart rate. A thermometer reading is pretty accurate. Like give me parameters that are reliable. But people they rely very heavily on the number. And theoretically, that would be great. The problem is the machines we have don't do a good job of giving us an accurate reading. And so I get on my little soapbox about blood pressure because I hate it. Mm-hmm. I would love it if we put like an art line and everything in the first, 30 seconds, but you can't do a triage exam and put an art line in 60 seconds, and therefore, don't care. So again, on paper, that sounds great, but in real life, I say, don't waste your time. And the other cool thing about that is the only piece of equipment that you need for a triage exam is a thermometer. Arguably, maybe also a clock or a watch of some kind, but I think if you get good at this, you don't even need that. You're like, yeah, I can ballpark it. I know about what that heart rate is. So you'll get good at that over time, but maybe a watch, but a thermometer, and that's it. You don't need a stethoscope, which throws people off. They think they need a stethoscope. It's like, I'm not a doctor without a stethoscope. You are. You can do a triage exam without a stethoscope because you can have what you're going to hear with your stethoscope doesn't tell you if a patient is stable or not. That might be part of your secondary assessment, right? If you're like, oh, this patient is not stable, it's not breathing well, and its cardiovascular parameters are crummy, then yes, ausculting that patient, use your stethoscope at that point, but you don't need it to decide where it should be triaged, what category. Those are some of my soapboxes, and those are some of the things overall the chapter's good, obviously. Obviously.
Yeah, it's a textbook.
Yeah. It's the literal textbook. But those are some of the things that I sort of approach differently. What else? Was there anything in there that like struck you?
No.
That's good. Violence is never the answer.
Ba-dum-bum.
So funny. Yeah, those are kind of the big takeaways. That's what I thought I'd point out are the things that I'm like, what are my thoughts on this? I don't know if that's what other people wanted or they just wanted me to review it, but if you want to just a review of my thoughts on triage, we have a video for that somewhere. Did we ever do this? Is this?
I think we did.
Yeah. So go back through like the catalog
50
and
videos.
Find something like that. I don't really know. Is it game time?
Yeah, it's game time.
It's game time.
Game time. All right. Today's game is
I'm nervous.
Quiz show. I forgot to get a sound bite for the game.
Quiz show.
Quiz show.
Sorry. I apologize for that.
All right. In quiz show, I'll be asking you some questions about triage, and you have to answer them.
Do I have to answer them correctly?
No.
Okay, good. What is this for? What are the stakes?
The stakes are, if you get them all right, everybody that listens is super impressed. And if you get them all wrong, you probably aren't
also impressed. I probably they all cancel. They no longer will listen to the show.
No, you're probably just not a vet anymore.
Oh, they take away my DVM?
Yeah.
Ouch.
Yeah. I guess you're.
How many questions are there?
1, 2, 3, 4. 4 questions.
Okay, but only if I get them all wrong. As long as I get at least one right, then I can keep my DVM.
Yeah.
No pressure.
All right. We're gonna start off.
And you wrote these questions. Are they multiple choice?
No, you don't have.
Good job, babe. I hate multiple. They're terrible.
All right.
That cat is weird.
You have to finish the question. Yeah, there's a time limit.
What?
You'll hear it. All right. The first question is, what language does the term triage originate?
French. The French language. The language from France. Yes.
Correct.
Okay. All right. I get to keep my DVM. Pressure's off. All right. This is good now. Do I need to wait until you play the music next time?
No, that was fine because you'd already answered it beforehand.
Good job. This is a good question.
All right. The second question is, list as many parts of the triage algorithm as you can.
The triage algorithm? When you say parts? Okay. So the neurologic system or the nervous system, the respiratory system, the cardiovascular system. Ding, ding. The urogenital system. I think those are the 4 systems you mean, right?
Yeah, that's good.
Yes. Even though I didn't actually want to count that 4th one.
Yeah. All right. Now we're moving on to the harder questions.
Oh, okay. Stepping it up.
Next question. Where did Erica Reinecke go to vet school?
Go to vet school? Did she go to Penn? Yes.
She went to Penn.
She's there now, but I didn't know if
She graduated the year before you did.
Nice. Oh, that was.
I think the year before you did.
That was
2002. You graduated in 2003.
I graduated vet school. No, I graduated undergrad in 2003. Vet school was 2007.
All right, she graduated a little bit before.
All right. That was an educated guess, but it was a guess.
Yeah.
That was a tough question.
Here's a toughie. Who were the lead actor and actress in the 2009 movie Triage?
There's a deer in our front yard.
Cool.
Are they actors that people have heard of?
Yeah. Well, here's what the movie's about. The wife of a photojournalist sets out to discover why he came home from a recent assignment without his colleague. Starring
Julianne Moore. And what year did it come out?
2009.
George Clooney. Were either of them right?
No, not at all. It was Colin Farrell.
Oh, that was going to be my second guess.
So much like George Clooney.
Yeah, I mix them up all the time.
Paz Vega.
God.
Nearly a stunt double for Julianne Moore.
I've never heard of that movie. Had you heard of that movie?
No, I just Googled
You Googled it.
I just Googled Triage. There was an album that I don't think anybody's ever heard of.
An album?
Yeah.
Like a musical album?
Musical album. And then there was a movie.
What was the band?
Apparently I forget. It was some dude. He was part of a band, then he wasn't.
A French band?
No. Apparently it's a popular book also, but the movie was based on the book.
Oh, interesting. I have to look into it. Did it get good reviews? Did you check it out on like Rotten Tomatoes or something?
I think it got I'd look it on IMDb. I think I got good reviews.
I mean, I
think I remember
actors.
when it came out.
Oh, really? I don't remember that. I like the actors.
Trailer for it.
Yeah, I was way off.
Yeah, you didn't get them all right.
Oh,
but
man.
You got 3
out of 4.
Boop,
boop, boop. That's like a passing grade, right? Yeah. I'm pretty pleased.
So you're still a vet.
Whoop, whoop. I'd say that 4th question was a teensy bit unfair.
What? You can't have all easy questions.
Well, I know, but
I have to be able to separate.
But like, if my veterinary degree is on the line, like, you know,
you just had to get 1 right, and you answered 2 of them in the.
Yes, you chose very good topical quiz. What did you think I was going to talk about? Those were like main points.
I don't know.
The other questions were pretty good. The Erica Reinecke, where she went to school. Because I was like, where is she working? I was like, oh, I know this one. And then I just went with the same school.
Yeah.
So it was a little bit getting lucky there.
Hopefully that's right. I Googled that too.
Oh, really?
I didn't.
We're going to go with that. We're going with that. No matter what. You can't go back and change it, even if that is not actually correct.
You got the other 2 right. So you still get your job.
That was pretty fun. Yeah.
That would have been tough.
The last question was actually, that last question was actually my favorite question. Though.
Yeah.
It was a good one. Now we have to try to find that movie and we can report back and see if it's any good.
Yeah.
Probably not. Mm-hmm. Okay. Well, all right. There it was, the first full chapter in Vet Books. And oh crap, what's the next chapter? So we will see you next time, which will be chapter 2.
Chapter 2
in a critical care textbook, which is physical examination and daily assessment of the critically ill patient. This one is by Tim Hackett. All right. Thanks for joining us, and we will see/hear you next time.
Yep.
Bye.